Hi, Dr. Andrea Maxim, naturopathic doctor and the creator of the Maxim movement. This video is going to teach you how you can better prepare and recover from any surgeries that you have in the upcoming future. Because we always want to make sure that your body is able to, number one, heal itself under any sort of stress or duress, and number two, of course, you want to be back on your feet as soon as possible. Now, before we get into that, I want you to hit that subscribe button so that you can get my videos every time I post one directly in your email box or on your YouTube channel. And of course, visit my website, www.themaximmovement.com, and have a boo around. Definitely look at the Maxim swag and join our e-newsletter list, where every month you're going to get a video on a different topic. And this video will better improve your health and help you maximize on your health every week on your own at home. Okay, so this video, as I said, is talking about how you can prepare for surgery as well as heal naturally afterwards with better recovery time. So some of the key elements that I use is I use a lot of nutrients, just basic supplements that your body is going to need, but I tend to use a lot of homeopathics. Homeopathics are an energetic way of treating the body. And the main reason why we use homeopathics is because they won't interact with the medications or anesthetic that you may have during your surgery. So we want to make sure that we're keeping your body super clean. Now, prior to your operation, there's a few things that you want to do. Number one, you want to make sure that your body is as alkaline and as cleaned up as possible. I'm not saying go on a huge detox or do a cleanse or anything like that, but definitely really try to think what's going to happen during this surgery. More often than not, there's going to be some inflammation and swelling and healing that's going to need to happen afterwards. So if we can get the body as alkaline as possible now, that would be a key thing for you to do for a couple weeks prior. Really flood in the nutrients, the green vegetables, the fruits high in antioxidants, and definitely minimize a lot of the foods that are going to make recovery time a lot longer, like your alcohols, processed foods, junk foods, frozen foods, things that aren't natural. And if you want to go even further, I would encourage you to avoid some of the more common allergens like dairy, gluten, eggs, that type of thing. So we want to really focus on the color, and we want to really decrease the amount of bad foods that we consume prior to surgery. Now, there's a few nutrients you definitely want to avoid in the weeks leading up to your surgery. Vitamin A and E in particular can prolong bleeding time. So if you are on those supplements, I would definitely stop taking those, because we don't want you to have any longer bleeding or have any issues with regards to clotting during the surgery. So taken from my personal experience, I would certainly stop vitamin A and vitamin E for about a week prior. Some doctors may even say fish oil, but I don't really agree with that. I don't think fish oil has a really significant effect on blood thinning, but definitely the other two mentioned, I would stop. All the other supplements, really, I wouldn't be too concerned. You can stay on your multivitamin, vitamin D, anything like that. Herbs you may want to decrease based on the medications that are going to be used during surgery. So you just want to confirm with your healthcare practitioner if there's any herb-drug interactions that you have to worry about. And there's a huge list for that, so I'm not going to go into that in too much detail. And the other thing I mentioned is homeopathics. So one of my all-time favorite homeopathics to use pre and post surgery is arnica. Arnica is a very widely used homeopathic, wonderful for healing muscles, sprains, strains, but it's an overall just kind of healing homeopathic for any sort of trauma that happens to the body. So I encourage patients to take 3 to 5 pellets, because they often come in little sugar pellets. 3 to 5 pellets every single day for the 7 days leading up to the surgery. Once the surgery is over, I encourage patients to do 3 to 5 pellets every hour for the first couple of days, and then start to spread out the dosage afterwards. I personally use arnica instead of Tylenol or ibuprofen. I've had a really bad sprain, I've had bad bruises, cuts and things, and I find the recovery from those injuries to be significantly improved, and my need for any other anti-inflammatory intervention to be greatly reduced, if not necessary at all. But arnica is definitely my go-to, and I've had so many patients say they just bounced right back after their surgery. So that's what I want to happen for you. Post-surgery, we want to stick to the very same type of diet that you were on leading up to it. Tons and tons of green leafy foods, tons of foods rich in antioxidants and nutrients that will help promote healing, and certainly stay away from the high sugary foods, dairies, glutens, things that tend to just bung up the immune system, because it's the immune system that we need to support as we are going through this healing phase. Certainly nutrients like vitamin C and zinc can be taken. They are wonderful at promoting healing. Vitamin C specifically for repairing any collagen stores that need to help put those tissues back together, and it's also excellent for supporting the immune system. Anywhere from 1,000 to 4,000 milligrams per day for, let's say, the week after the surgery. If longer, you can certainly take it. Zinc, I generally don't do any more than 15 to 25 milligrams per day, and that's short-term use. You don't want to be on zinc long-term. And again, I mentioned the arnica. If there was any nerve damage that was done, hypericum as a homeopathic is an excellent one for you to take. If there was any surgeries done to the abdominal tissue, or they had to cut into the abdomen or the stomach area, a homeopathic called Bellis perennis is a great one. If there was a fair number of needle punctures or any sort of puncture wounds, Ledum as a homeopathic is excellent. And with regards to dosage, anywhere from a 30 CH to a 200 CH is what I generally prescribe. With regards to swelling or any bruising, arnica is an excellent one, but there's also other products on the market that help with lymphatic drainage. One that I can think of off the top of my head is Lymph-Diarrhea, but anything with lymph in it is most likely going to be excellent for helping the immune system carry away a lot of the toxins. It's going to help reduce the swelling, the bruising color significantly, and that can be taken along with the arnica. If there's no open wounds or open cuts or anywhere where there's stitches, to help promote the healing and also reduce scarring, I tend to use castor oil. Castor oil cannot be applied to anything that's open, so you definitely don't want to have a gash that has a scab or anything around it. But if it's a closed area, like a broken bone underneath the surface, or bruising or swelling, or any ligament or tendon tears that, again, there's no open wound to that, castor oil can be applied every single day, if not a couple times a day. Castor oil has this wonderful ability to irritate the skin and bring fresh blood flow to that area, which will also then help remove toxins from the area as well and improve healing. And even for scarring, you may want to use something like bio oil or rosehip oil. That can significantly help to reduce the scars, but needs to be applied multiple times a day for at least a couple of months. If you have any questions or comments, please do not hesitate to contact me or post them below if you're on my YouTube channel watching this. Again, please visit my website, www.themaximmovement.com, and join the Maxim movement. And subscribe to this channel. Make sure that you're getting notifications for all of my upcoming videos. And as always, take care of yourself, maximize your health, and have a happy and healthy day.